After a surgical procedure on the shoulder, a period of mobilization is going to follow. And after a period of mobilization, there are several things that happen to the thoracic spine, the scapulothoracic and the scapulohumeral joints. We're going to explore the opportunity of using a Sling Matrix to help mobilize the scapula, the scapulothoracic, scapulohumeral, and the thoracic spine while the shoulder's in the sling, and giving relative joint motion and not causing any type of discomfort or pain to the surgical area. So when we're in the sling, one way that we can mobilize the thoracic spine, the scapulothoracic and the scapulohumeral, is basically to just do a stepping pattern, which will allow us to get the scapula to move along the thoracic wall at all three planes of motion. So we're going to do an anterior and a posterior step, a lateral step, and a rotational step. So 6 angulations so I can get some thoracic spine mobility from the ground up. So we're going to do an anterior step. We'll do a left lateral step, a right lateral step. We'll do a left rotational step, a right rotational step. We'll do left rotation anterior and right rotation anterior. The next logical progression to mobilize the scapulothoracic, scapulohumeral, and the thoracic spine would just be to use trunk driving. So instead of using a stepping pattern, we're just going to use a trunk to drive the scapula along the thoracic wall. We're looking at this going to be an anterior and a posterior trunk drive, left lateral, right lateral trunk drive, right rotation, and left rotation. The next logical progression for the Sling Matrix is to use the opposite arm as the driver of the motion. So we're going to go flexion and extension, ab and adduction, and we'll go internal rotation and external rotation. So when we think about our patients or athletes that have been immobilized for a period of time after a surgical procedure, we want to find a way to mobilize the thoracic spine and get the scapula to move on the thoracic spine while they've been immobilized for a period of time. So when they come out of the sling, we are ready to go with more active mobility techniques. So if we're going to think about a simple way to get the scapula to move along the thoracic wall while the sling's on from the ground up, it would just be an ordinary stepping pattern. So we can get the scapula to anterior tilt and posterior tilt. We can get the scapula to adduct and abduct. We can get the scapula to right rotate and left rotate along the thoracic wall from the ground up. Normally when we walk, it's always a linear fashion and anterior. So our patients relatively never walk in these other movement patterns, so we can get the scapula to move sooner and quicker in patterns it's not able to do because of the surgery. The next option we would have to be able to mobilize the scapula would just to be able to do a simple trunk drive. So you get flexion and extension of the trunk, which would get the scapula to move anterior and posterior on the thoracic wall. We could do a right and left lateral side bend, which will give the scapula the ability to move on the thoracic wall just by trunk driving. And then we can also just do a simple rotation of the trunk to get the scapula to internally rotate and externally rotate on the thoracic wall. And then the final piece of the Sling Matrix is going to be using the opposite arm as the driver of some of those motions. So we can get a flexion and extension moment to get the scapula to move on the thoracic wall. We can get ab and adduction to get the scapula to do the same kind of mobility. And then we can get internal and external rotation of the scapula on the thoracic wall by using the uninvolved arm to drive that scapula around, and also primarily get a lot of thoracic spine motion, which our patients are not getting when they're immobilized in the sling.